But we always knew that our older adult patients were challenged by the hospital environment, experiencing delirium and falls and adverse drug events and immobility and functional decline. So our thinking based on our work in home-based primary care was that if we could provide hospital level care in the home as a substitute for care provided in the traditional bricks and mortar, that our patients might actually do better.
The hospital at home model achieves very strong outcomes, and that's for a variety of reasons. Patients are in a controlled environment. You're not on a hospital floor with dozens of different exposure risks. Patients could often move around more at home, and patients generally feel better and happier at home. And that's, I think, an important component to the overall recovery process.
We went to one of our partner hospitals and said, look, we can take these clients out with our team, with our technology, and with our capabilities. And in 24 days, we stood up a hospital at home program, and we started taking clients right directly out of the ER that were hospital appropriate.
We spend time with our customers talking about is how they can build privacy and compliance programs doing what they're already good at, protecting their clients and their patients, documenting their care. These things are in the DNA of great home care providers all across our customer base. And when I talk to them and when we plan security and privacy programs to collaborate together, these are the things that can provide the cornerstone even to a small provider who doesn't have a lot of resources.
5-6 years ago, you could get by without a comprehensive EMR system and still relying heavily on paper. You know, I would be at agencies that would still have the little mail slots, and you would hear the constant opening and the dropping of the paper timesheets in there. And so really in the past, you could get by, but now with the upcoming 21st Century Cures Act, with EVV that Janice mentioned, I mean, it kind of just opens this door to this huge kind of digital transformation shift that's going under the industry is going to go under.
Economy begins to recover, I do worry about people leaving healthcare because they just can't do it anymore. So I think we need to support our people as much as we can right now, try to give them a break somehow, work for wage parity with other parts of the healthcare sector, reinforce the value of what they're doing, put great technology in their hands so they feel well connected.
We have seen an acceleration of the shift of care setting into the home. Obviously, in the midst of a raging pandemic, a lot of that has to do with how hard it is to do infection control in a congregate care setting.
I think it's time to sit, think, and strategize as we move forward, because we're not what we were before. We need to look at ways that we can move forward. And one is direct care workers. I think now more than ever, we really need to take a hard look at how do we communicate with them? How do we train? How do we appreciate and all those things? And I think it would really benefit as we move into the new year.